Joining us tonight is Dr. Heather Krebsbach. She is a functional medicine naturopathic doctor and acupuncturist practicing in Portland, Oregon. She specializes in women's health, digestive conditions, autoimmune disorders, and cancer care. She strives to be an educator, investigator, and perpetual student while providing comprehensive, personalized care to her patients. As a naturopathic doctor and acupuncturist, she has almost 20 years of clinical experience treating people of all ages and a wide array of conditions. She cherishes treating her patients, their friends, and their community.
I'm Dr. Heather Krebsbach with Intergate Health and Wellness Clinic in Portland. I want to start by thanking Legacy for inviting me. The last time I spoke to the group was many, many years ago while sitting at a small round table in the hospital. I appreciate the opportunity to return and to talk to the larger Legacy community and hopefully offer some insights or resources for complementary services. As mentioned, I'm a naturopathic doctor and acupuncturist, providing care to a wide array of patients and conditions since 2007. Today, I'm going to focus on how I support my patients through their oncology journey utilizing acupuncture. This talk is designed to give you an overview of acupuncture, what it is, how it works, and the specific symptoms that it can help to manage. At the end of the presentation, I'll save some time for questions. Throughout my academic and clinical journey, both in school and during my postgraduate residency, I had the opportunity to work alongside three influential doctors who specialized in naturopathic and acupuncture oncology. These three experiences, in addition to my years in clinical practice, provided me with invaluable perspectives on how to support patients throughout their oncology journey, from the initial diagnosis to recovery. Today, I'll discuss how acupuncture can serve as a beneficial tool in managing the predictable symptoms associated with each phase of cancer treatment, and how acupuncture protocols can be tailored to meet the unique needs of the individual patients. As we know, the oncology journey can be broken down into several distinct phases, each with its own set of challenges or symptoms. Today, we'll focus on chemotherapy, surgery, radiation, and recovery. But before I dive into how acupuncture can be beneficial throughout these phases, I think it's important to start with how acupuncture is explained in the traditional sense, and then dive into what modern medicine says about it. A traditional explanation of acupuncture is based on the concept of qi, or vital energy, which flows through the body's meridians. Imbalances in the qi are believed to cause disease. By inserting needles at specific points, acupuncture is thought to unblock these obstacles and restore the free flow of qi, helping the body heal itself. Modern research has a different explanation for how acupuncture works, and it suggests that acupuncture may actually stimulate the nervous system to release neurotransmitters, which can help reduce pain. It can regulate blood flow and reduce inflammation in the body, which may support tissue repair and healing. Lastly, it may influence the autonomic nervous system, promoting relaxation and reducing the stress response. With these functions in mind, acupuncture can be used for a wide array of conditions and individuals. Acupuncture as a complementary to cancer treatments has shown significant potential in helping to manage the side effects of each phase of cancer treatment and enhance overall recovery by addressing the physical and emotional needs of patients. Since the side effects of chemotherapy, radiation, and post-surgical recovery are often predictable, we can anticipate the symptoms an oncology patient may face and tailor treatments accordingly. This allows us to intervene early, helping to prevent or alleviate the severity of symptoms as the patient progresses through their journey. One of the key advantages of acupuncture is that it doesn't involve taking anything by mouth that would potentially interact with chemotherapy or radiation. Instead, patients usually get to relax while they're on the table, and it makes it a very stress-free treatment. The most common symptoms of chemo, surgery, and radiation that I'm treating are neuropathy, nausea, digestive upset like reflux, diarrhea, constipation, fatigue, insomnia, stress, headaches, body pain, and hot flashes. Chemotherapy can be one of the most challenging phases of cancer care due to its range of symptoms and side effects. And acupuncture during chemotherapy can reduce the severity of nausea and vomiting, alleviate pain, enhance appetite, and improve emotional well-being. By reducing the symptoms, patients can maintain a higher level of energy and stay more engaged in their treatment. The research surrounding acupuncture and reducing nausea is pretty well regarded. There have been over 40 randomized controlled trials investigating the effectiveness of stimulating the acupuncture point PC6 on the inner wrist for reducing nausea and vomiting. Organizations like the American Society of Clinical Oncology have recognized acupressure at PC6 as a useful complementary treatment for nausea in patients undergoing chemotherapy. This has led to a wide variety of patients beyond chemotherapy to use the over-the-counter nausea bands on their wrists, which stimulate the PC6 point. So this usually means that PC6 is a part of most acupuncture treatment plans when focused on reducing nausea. Studies also suggest that acupuncture can help regulate gastric motility and improve digestive function, which may be the reason it helps with reflux, diarrhea, and constipation. Studies also show the benefits of acupuncture on neuropathy. A 2022 review of research determined that acupuncture is a beneficial and cost-effective option for managing peripheral neuropathy caused by diabetes and chemotherapy. One of the major studies cited is a randomized controlled trial of 40 breast cancer survivors. The women in the study were randomized between an immediate acupuncture group and a delayed acupuncture group. The immediate group received acupuncture immediately following taxane chemotherapy, while the control group waited 8 weeks to receive the acupuncture treatment. The participants in the immediate group received 18 acupuncture treatments over an 8-week time period. The studies showed that the course of acupuncture immediately following taxane chemotherapy led to a statistically and clinically significant improvement in the participants' pain and neuropathy compared to the patients who received acupuncture 8 weeks after finishing chemotherapy. When I see patients in my practice, I'm focused on reducing their overall symptoms, not only to benefit their quality of life, but also to help their resilience in completing their oncology treatments. So in addition to addressing neuropathy, nausea, and their physical health, we're often discussing the patient's emotional and physical health. There are a number of acupuncture points around the body that can promote a sense of calmness or reduce stress. As we move through the cancer journey, for many, surgery is a pivotal moment in a patient's cancer treatment. While surgery can often offer the possibility of remission, it also comes with physical recovery challenges, including pain, swelling, fatigue, and emotional stress. Studies have demonstrated that acupuncture can significantly lessen post-surgical pain, particularly when used in the immediate days following surgery, and may help patients reduce their reliance on opiate medications for pain management after surgery. The radiation phase may be one of the last treatment phases, and generally by this point, we're focusing on ways to improve a patient's energy level. I'm typically choosing points that are calming to the nervous system, and we're continuing to focus on digestion and pain management and tissue healing. Once we reach the recovery phase, we take a breath and we reassess and reset. At this point, much of our treatment addresses both physical and emotional well-being. This phase also can vary greatly in the length of time, meaning that a patient may continue acupuncture monthly for 6 months or, treatments up to a year, depending on their symptoms. I'm typically addressing any lingering physical symptoms such as neuropathy or pain, as well as sleep disturbances associated with the accumulation of stress. But some of the sleep disturbances are also due to hot flashes or joint pain that may arise while they're taking tamoxifen or aromatase inhibitors. And acupuncture actually shows benefits in regulating hot flashes through multiple functions like reducing the stress response, regulating circulation, and reducing endorphins. So even though the symptoms can be predictable, a patient's experience with cancer is unique, as we all know. So one of the key takeaways from my work in integrative oncology is the importance of individualized treatment plans. The acupuncture protocols must be adapted to meet their specific needs, which involves assessing the severity of symptoms, monitoring emotional and physical responses to the treatment, and adjusting acupuncture protocols based on the individual's progress. For those who haven't experienced an acupuncture treatment, I would tell them that it should feel relaxing. After taking a detailed history, the acupuncturist will feel the patient's pulses. They may look at their tongue to assess the color and the coat. And all of these observations are part of the traditional Chinese method for diagnosing. It helps the clinician know what the underlying conditions are or what points they may want to use during the treatment. Then during the treatment, most patients can count on a nap or at least some time to relax, and the overall experience should be relaxing. The frequency of treatment depends on the patient's oncology phase, as well as the severity of their symptoms. Treatments closer together are often more beneficial than treatments further apart. So I typically recommend weekly acupuncture sessions until after their active oncology treatment. For patients on medications like Arimidex or tamoxifen, or patients recovering from surgery, acupuncture sessions are usually weekly until the symptoms are under control. And then once the more intensive weekly treatments are completed, the patient transitions to monthly visits or acupuncture as needed. During the first year of recovery, a patient may continue acupuncture monthly to continue working on stress, hot flashes, and joint pain. And the frequency again should match the severity of symptoms. When I'm asked which oncology patients would I not recommend acupuncture for, my answer is pretty simple. The treatment should never feel stressful to the patient. So if a patient is nervous, anxious, or has a fear of needles, then perhaps acupuncture isn't the best treatment for them. In these cases, perhaps a more suitable treatment would be massage from a certified oncology massage therapist. For all other patients, I tailor the treatment to their specific needs, ensuring that I avoid certain areas, such as those recovering from surgery or regions that may be prone to infection. So, for instance, patients undergoing radiation, I make sure to avoid the actual radiation site. So when seeking an acupuncturist, it's important to find someone who's suited to your particular needs. It's okay to ask about the practitioner's specific experience, especially when it comes to treating oncology-related symptoms. All acupuncturists in Oregon are licensed through the Oregon Medical Board. And just like MDs, PAs, and DOs are also licensed through that board. At Intergate Health and Wellness Clinic, we have 7 acupuncturists with over 90 years of combined experience treating a wide variety of conditions. We provide supportive cancer care from diagnosis through remission, and our goal is to help ease some of the challenges of our patients' treatment journeys. Additionally, to the treatment we offer our cancer patients, we also offer care to their caregivers. We help them to manage stress, insomnia, fatigue, which may also arise from the stressors that they're under. Incorporating acupuncture into cancer care can be a powerful tool in supporting patients through their treatment journey. Whether it's addressing nausea, neuropathy, pain, or stress, tailoring acupuncture treatments ensures that the patient receives the most relevant and effective care possible during each phase of their oncology journey and after. Thank you for your attention. Now I'll open up the talk to questions.